Hi, my name is Ashley Foster, and I am an emergency medicine and pediatric emergency medicine doctor in Massachusetts. I am also the Massachusetts Pediatric Emergency Care Coordinator Network Chair. For the next few minutes, I'm going to talk to you about the push-pull fluid administration technique and how you can teach the skill of push-pull fluid administration using a do-it-yourself simulator model made from materials that you can find in your usual equipment armamentarium. As Dr. Auerbach highlights in the introductory PowerPoint presentation, using simulation as a teaching tool can be incredibly valuable and does not require expensive simulator models. First, let's briefly review when to think about rapid administration of fluids in a pediatric patient. Children have some slight differences in how shock is manifested in their bodies. Some of the worrying signs that a child is developing shock include tachycardia, tachypnea, weak peripheral pulses, delayed capillary refill, mottled appearance or diaphoresis, confusion or lethargy, and hypotension. Although there are multiple etiologies of pediatric shock, a common cause of shock that leads to rapid deterioration in the pediatric patient is sepsis. In the United States, there's an estimated 75,000 cases per year of pediatric sepsis, with an in-hospital mortality of 5 to 10%. For children in particular, hypotension is a late clinical finding, which requires immediate action to avert disaster. Current resuscitation guidelines recommend rapid intravascular administration of isotonic crystalloid as an essential component of the initial resuscitation and stabilization of pediatric shock. Since septic shock commonly manifests as intravascular hypovolemia due to reduced fluid intake superimposed on vascular dysfunction and microvascular leak, rapid fluid resuscitation is an important and necessary step to the management of pediatric septic shock. Of note, cardiogenic shock, obstructive shock, and other things like DKA or poisonings may need a different approach to IV fluid management in children. The new surviving sepsis guidelines were published in March of 2020 and outline fluid administration in a child with sepsis or septic shock. Besides obtaining a blood culture and administering broad spectrum antibiotics for a child that has suspected sepsis or septic shock, IV fluid administration is a cornerstone of management. In healthcare systems with access to intensive care, these guidelines recommend administering a 40 to 60 ml per kilo bolus in 10 to 20 ml per kilo bolus aliquots within the first hour, titrated to markers of cardiac output. Of note, fluid should be dosed in ideal body weight. Also, fluid administration should be stopped with any signs of fluid overload. In healthcare systems with no availability of intensive care, and the patient has signs of sepsis with hypotension, the surviving sepsis guidelines now suggest administering up to 40 mLs per kilo in a fluid bolus in 10 to 20 ml per kilo bolus aliquots over the first hour, with titration to clinical markers of cardiac output, and discontinuing fluid if any signs of volume or fluid overload develop. Remember that markers of cardiac output can include vital signs such as heart rate or blood pressure, as well as physical exam findings such as capillary refill time, mental status, and urine output. There are multiple ways that we as an emergency team can administer IV fluid to a pediatric patient in shock. Gravity flow, pressure bag support, rapid infuser device, and the push-pull methods all can be used. The push-pull technique can be used and lead to not only rapid but precise administration of IV fluids, as it is much easier to know the exact volume delivered to the pediatric patient. The push-pull method requires a single provider and a single syringe. The first step in the push-pull method is to toggle the stopcock to the off position to the patient. The provider then withdraws fluid from the IV fluid bag into the syringe by pulling back on the plunger. The next step is to turn the stopcock to the off position to the IV fluid bag. The final step is to depress the plunger, which infuses the exact amount of fluids in the syringe into the patient. A study by Dr. Stoner et al. Published in Annals of Emergency Medicine put in a randomized controlled trial the push-pull method in a head-to-head comparison with fluids to gravity and pressure bag. The goal of the study was to administer 20 ml per kilo fluid within 5 minutes, which at the time was a 2002 American College of Critical Care Medicine guideline for the management of sepsis in children. Fluids to gravity perform the worst, with pressure bag and push-pull group performing equally in terms of fluid delivery rate, ability to achieve the ACCM guidelines, and fluid volume delivered for children weighing less than 40 kilograms. The push-pull method for fluid administration is a great way to deliver accurate volumes of fluid rapidly to a pediatric patient. In the next video, I will walk you through how to create a push-pull simulator model using equipment available in your emergency setting. You can use this model to teach the push-pull IV fluid delivery skill or embed the skill within a clinical scenario. In order to create the do-it-yourself simulator, you will need IV tubing, 2 IV fluid bags, a 20-gauge catheter, a 3-way stopcock, IV extension tubing, and a pair of scissors. An extra bonus is if you have a paper doll or mannequin to make the simulation more realistic. The simulator model creates a closed circuit with 1 bag full of IV fluid and 1 bag empty. You will take the empty fluid bag and place this under the mannequin or paper doll for the simulation. The full IV fluid bag represents a hanging bag of IV fluid used for the push-pull method. The circuit can be reused many times. In summary, the push-pull method is a great way of IV fluid delivery in a pediatric patient with shock, especially sepsis. The method has a benefit of being able to be performed by a single provider, allowing for rapid administration of IV fluid, and allows for exact known small volumes of IV fluid to be delivered. Thank you so much for your attention.